moms, have you ever felt very painful while breastfeeding? Usually, the pain will be accompanied by a high fever, which is above 38 degrees Celsius. So today, we're gonna talking about mastitis, a breast pain during lactation. Mastitis is an affliction that most breastfeeding moms dread. But here's the good news. There are some simplest ways to reduce your chance of getting or to treat it. So, in this video, we're gonna talk about it, and if you wanna know, just keep watching. Hello moms, how are you today? I hope your day full of blessing and happiness. Welcome back to my YouTube channel. My name is Mariana Salsabila. I'm a midwifery student at Medical Faculty of Brawijaya University. There is no nice way to say it. Mastitis is a pain in the bone. Mastitis is when there is inflammation of the breast tissue, sometimes occurring with an infection. Mastitis typically rears its head around the first 6 weeks postpartum. When a woman decides to breastfeed her baby, she is making a significant commitment that influences decisions about herself, her baby, and her family. For most postpartum women, breastfeeding is an important milestone in their life. It promotes mother-infant bonding and offers numerous health benefits for both the mother and the infant. A common and often underdiagnosed complication is mastitis. The risk factors of mastitis include inadequate emptying of breast caused by infrequent feeding or pumping, persistent enlargement or plaque attack, a poor leg, restricting feeding times, an oversupply of milk, or repeat weaning. If you think about it, your bobs are constantly exposed to bacteria, baby saliva, moisture, the atmosphere, so combined with the stress of having a new baby, it was additional causes of mastitis. So, okay, now that we know what mastitis is, let's discuss about the symptom sign. Swollen births that can be hurt or hard to touch. You may see red areas on the breast and that can be red streak. Lump in the breast pain, flu-like symptoms such as fever of 38 degrees Celsius or higher, chills, fatigue, general aches and pain, and you may have a decreased milk supplies on the active side. So, that's where things can get serious. Mastitis can lead to a breast abscess, and you need to stay alert. If your symptoms are mild, you can treat conservatively at first, like frequent and effective milk removal is more important part of treatment. If breastfeeding, massage during the feed and try different positions, including ones where the baby's change or nose are pointing toward the affected areas. Breastfeeding should be continuous during this time. If your baby refers the breast, replace feed with pumping until your baby returns to the breast. If you have been exclusively pumping, it is important to be pumping a minimum of 8 times a day. Your milk supplies may drop significantly on the affected side even with frequent emptying. Just keep emptying and will likely return to normal once the mastitis clears. Before feeding, you can use a warm washcloth heating pad, or hot water bottle on your infected bird. Leave it there about 5-10 minutes. The heat really helps to loosen up the lump that gnawed and showed the soreness. Massage the blocked area during pumping or feeding. If needed, you can take anti-inflammatory such as ibuprofen for pain control and to reduce swelling. Drink plenty of fluids, eat a well-balanced diet. And the last one, rest and reach out for support to decrease stress and fatigue. If you have a high fever or if symptoms worsen or do not improve after 24 hours of conservative treatment, seek medical attention immediately from the doctor, midwife, or closest emergency department if you need antibiotic or future investigation. Okay, I think that's enough for this video discussion about mastitis. Hopefully it will be useful for you and see you next time. Thank you.